Good afternoon. The topic for paper presentation is clinical study of etiological pattern and clinical features of uveitis in the pediatric age group. Why pediatric uveitis is special? Pediatric uveitis, even though having less incidence, differ from adult onset uveitis and is a topic of special interest because of its diagnostic and therapeutic challenges. The delay in diagnosis, high ocular morbidity, risk of amblyopia, and they are more prone to develop sight-threatening complications. Uveitis is responsible for approximately 20% of blindness worldwide, and the prevalence in developing countries are more compared to developed countries, and the prevalence is about 5 to 10-fold lower in children than in adults. The aim of my study is to study the etiological pattern of pediatric uveitis and to study the clinical features. Materials and methodology. The study design was a hospital-based cross-sectional study done in Tertiary Eye Care Hospital, Trivandrum, and all the uveitic patients presented to our hospital of age less than or equal to 17 were taken, and the study period was 1 year, and the sampling technique was consecutive sampling. The inclusion criteria. Age less than or equal to 17 years at the time of diagnosis. Exclusion criteria, excluded if they had any post-operative complication, post-surgical inflammation, or ocular trauma. The sample size was calculated to be 21 according to the previous yearly presentations. The methodology, that participants who met the inclusion criteria were consecutively recruited in the study till the required sample size is obtained, which was followed by a clinical history including age, gender, place of residence, history of exposure to risk factors, followed by a uveitic ocular examination. The history was followed by ocular examination including the best corrected visual acuity, intraocular pressure by non-contact tonometry, ocular motility, slit lamp biomicroscopy, and indirect ophthalmoscopy. And the data analysis was done using SSPS software. The study results I have got, there was no particular gender preponderance found. Male and female groups contributed almost equal. Then in laterality, about 76% were unilateral and bilateral contributed 23%. Pathology, majority of cases were non-granulomatous, about 71%, and 28% were granulomatous. Course of the disease, most of them had an acute onset, that is 66.67%, followed by chronic 23% and recurrent 9%. And this is the etiological classification. Majority of them were infectious causes, about 42.86%, and the idiopathic and non-infectious causes contributed to 28.57%. Then the etiological diagnosis, a major proportion was found to be infectious causes, and among them it included toxoplasmosis, tuberculosis, viral, and a single case of DUSN was have got. Then majority of non-infectious cause was juvenile rheumatoid arthritis, 5 cases, and in that 2 cases presented as band keratopathy, the first presentation itself, which shows the presentation of juvenile rheumatoid arthritis as white uveitis. The location of disease, anterior uveitis contributed a major portion, followed by posterior, intermediate, and pan uveitis. Discussion. In my study, there was no gender preponderance found. Most cases were unilateral, majority were non-granulomatous, most of them had an acute onset, and etiology-wise, infectious cause was contributed a major portion, and anterior uveitis was most common. And in the study done by Narayana et al., there also most cases were unilateral, but in the study anterior, intermediate, and posterior uveitis was seen in equal numbers, and infectious causes were most common. And another study done by Ratnam et al. Found to be anterior uveitis was most common and infectious causes contributed a major portion. These two were studies done in developing countries, and it shown infectious etiology was more common there. And another 2 studies by Tutkun et al. Found uveitis associated with non-infectious, and among them juvenile rheumatoid arthritis was more common, followed by idiopathic uveitis. And another study by Kum et al. Found etiology was mostly non-infectious and non-granulomatous presentation was more, and laterality, bilateral presentation was more common. The conclusion is that In my study, anterior uveitis was most common, followed by posterior intermediate panuveitis. Infectious etiology was more than non-infectious, and among the infectious cause, toxo, tuberculosis were more common, and among non-infectious, juvenile rheumatoid arthritis was common. And some children were diagnosed to have uveitis as part of routine ocular examination in patients like with juvenile rheumatoid arthritis. And young children are often asymptomatic either because of their inability to express the complaints or because of a truly asymptomatic nature of their disease. And in some cases of advanced cases, parents may not be aware of severe visual impairment until the development of externally visible changes such as band keratopathy, strabismus, or leukocoria. So early and correct diagnosis, efficient management of uveitis in children is mandatory. These are my references. Thank you.
A good presentation. Thing is, yours is a retrospective study or a prospective study?
Prospective. It was a cross-sectional study.
But what does literature state as the common causes for uveitis in children?
Juvenile rheumatoid arthritis was more commonly found in developed countries, sir. And in developing countries like ours, infectious causes were found to be more common.
So yours was a descriptive cross-sectional study, isn't it? Then why did you have to fix your sample size?
According to previous records in the presentation of our hospital, study duration was 1 year, sir. According to previous records, I have calculated like that. In 1 year, about presentation was almost 16-20 cases.
Yeah, but so what if you had got 50?
Yes, I got only this much, sir.
Yeah, so it was not that that number was
was
not
a limit.
important at all. No, only the
Yeah.
time period was important.
Yes, sir.
It wouldn't have made any difference to you,
Okay, sir.
to your study.